Shocking. How to treat a bee sting before it gets dangerous. Introduction. Why bee stings can be dangerous. Did you know that bee stings are more common than most people realize? According to medical reports, thousands of people are stung by bees every year, and while many experience only mild symptoms, others face severe allergic reactions or even life-threatening complications. A simple bee sting can escalate into a medical emergency if not treated properly. Imagine being stung while hiking in a remote area, gardening alone, or even at a picnic with loved ones. Would you know what to do? Every second counts when dealing with a bee sting, especially if symptoms begin to worsen. In today's video, we'll uncover step-by-step instructions to treat a bee sting effectively and prevent it from becoming dangerous. Whether it's for you or someone you care about, this information could save lives. Stay tuned, give this video a like, and share it widely. It could make all the difference in a critical moment. Let's dive right in. Orkenwars. Yars 1. Recognize the symptoms, more than just a sting. The first and most crucial step in treating a bee sting is recognizing its symptoms. While most stings cause immediate pain, swelling, and redness, the body's reaction can vary depending on the person. Mild reactions. For many, a bee sting results in sharp pain at the site, redness, slight swelling, and itchiness. These symptoms usually subside within a few hours and are manageable with basic home remedies. Moderate reactions. Some people experience more significant swelling that grows over the next 24 to 48 hours. This reaction, while not life-threatening, can be extremely uncomfortable and requires additional care. Severe allergic reactions. Anaphylaxis. Here's where things can get dangerous. In rare cases, a bee sting can trigger anaphylaxis, a severe and potentially fatal allergic reaction. Symptoms include difficulty breathing, swelling of the throat and tongue, dizziness, rapid heartbeat, and loss of consciousness. Immediate action. If you or someone nearby shows these signs, call emergency services right away. Delay can be fatal. Even if anaphylaxis is suspected, proceed with first aid steps while awaiting help. Takur 2. Remove the stinger. Immediately, time is critical. Bees leave their stingers behind when they sting, unlike wasps or hornets. The stinger contains venom that continues to release toxins into your body until it's removed. The faster you act, the less venom enters your system. Chaperweets. How to remove the stinger. 1. Don't squeeze or pinch. Squeezing the stinger can push more venom into your skin. 2. Use a flat object, like a credit card or the back of a knife, to scrape the stinger out gently. 3. Avoid using tweezers unless you have no other option. If tweezers are used, grip the stinger as close to the skin as possible to minimize venom injection. Why this step is vital. Every second counts. Studies show that removing the stinger within 30 seconds can significantly reduce the severity of the reaction. The venom contains proteins that attack cells in the immune system, causing inflammation and pain. Quick removal minimizes these effects. Chakterfurus. 3. Wash the area. Thoroughly prevent infection. Once the stinger is removed, the next step is cleaning the area. Bee stings can introduce dirt and bacteria into the skin, increasing the risk of infection. Jurakir. Steps to clean the wound. 1. Wash the area with foam, soap, and lukewarm water. Use a gentle, non-abrasive soap to avoid further irritation. 2. Rinse thoroughly to ensure no venom or dirt remains. 3. Pat the area dry with a clean towel. Do not rub, as this could worsen irritation. Importance of cleaning. An untreated bee sting wound can develop redness, pus, and swelling due to infection. Proper cleaning reduces this risk and prepares the site for further treatment. Ursax, Battery 4. Control swelling. Use cold compresses. Swelling is one of the most common reactions to a bee sting. While it's normal, excessive swelling can cause discomfort and restrict movement, especially if the sting is near joints or sensitive areas like the face or neck. How to reduce swelling. 1. Apply a cold compress or an ice pack wrapped in a cloth to the sting site. 2. Keep the compress on for 10 to 15 minutes at a time, taking breaks to avoid frostbite. 3. Elevate the affected area, if possible, to minimize blood flow and reduce swelling. Additional tips. You can also use over-the-counter antihistamines to reduce swelling and itching. Medications like diphenhydramine, Benadryl, are effective, but consult a doctor if you're unsure. Suckers. 5. Neutralize the venom. Home remedies that work. Bee venom is acidic, and neutralizing it can help reduce pain and inflammation. Several home remedies are effective and easy to use. Top home remedies. 1. Baking soda. Paste. Mix baking soda with water to form a paste and apply it to the sting. Let it sit for 15 to 20 minutes before rinsing off. 2. Honey. Known for its anti-inflammatory properties, honey can soothe the sting site and prevent infection. 3. Apple cider vinegar. Dab a small amount onto the sting to neutralize the venom. 4th. Toothpaste. Many toothpastes contain alkaline ingredients that help counteract the venom's acidity. What to avoid? Do not apply alcohol or hydrogen peroxide, as these can irritate the skin further. Avoid scratching the area to prevent secondary infections. 6. Monitor for delayed reactions. The danger isn't always immediate. Bee sting. Reactions don't always show up right away. In some cases, symptoms can worsen hours or even days later. Signs to watch for. Persistent swelling or redness that spreads beyond the sting site. Development of a fever, chills, or pus-filled blisters. New or worsening pain after the initial sting has subsided. When to seek help. If you notice any of these symptoms, consult a healthcare provider immediately. Secondary infections or delayed allergic reactions can occur, and timely treatment is crucial. 7. Prevent future stings. Stay safe outdoors. Prevention is better than cure. Avoiding bee stings altogether is the best strategy, especially if you're allergic or live in an area with high bee activity. Tips for avoiding bee stings. 1. Wear protective clothing. Cover exposed skin when gardening, hiking, or spending time outdoors. 2. Avoid strong scents. Bees are attracted to floral perfumes, lotions, and bright clothing. 3. Stay calm around bees. Sudden movements can provoke them. If a bee approaches, move slowly away. 4. Keep food covered. Bees are drawn to sugary drinks and snacks during picnics. 5. Inspect your surroundings. Check for nests or hives before engaging in outdoor activities. Conclusion: empower yourself with knowledge. A bee sting can range from a minor inconvenience to a life-threatening emergency. By understanding how to act quickly and effectively, you can protect yourself and others from the dangers of bee stings. Remember to always remove the stinger promptly, clean the area thoroughly, and monitor for any worsening symptoms. This knowledge isn't just practical, it's life-saving. Share this video with friends and family, and don't forget to like and subscribe for more valuable health tips. Let us know in the comments. Have you ever been stung by a bee? How did you handle it? Stay safe, and thanks for watching.